Welcome back to the new norm. I'm Dr. Lou Graham, and this program is brought to you by Midway Education. I should say Midway Dental and Catapult Education. With that being said, this is a fun interview for me. So, pre-COVID times, I'm down in Florida in Boca Raton visiting my mom. And my partner, Tony Tamaro, who I've talked about numerous times, calls me on the phone and says, I have this new product that you gotta look into, and it's called ioRinse. I go, never heard of it. And he tells me that his former hygienist of so many years swears by this product, and her name is Patty Sajak. So she's practicing in Las Vegas for the group that bought Tony out. Tony moves to Chicago. I'm in Boca Raton. And what do? I call up this company, ioRinse. Well, I don't even call them up. I go online, and sure enough, they're in Boca. I'm in Boca visiting my mom. So what a perfect excuse to leave mom, so to speak, and go visit Herb Moskowitz. So this is what happens. I call Herb up, and Herb, who, by the way, I'm going to tell him, he's a Tennessee volunteer. He graduated from University of Tennessee Dental School over 25 years ago. We'll do that in parentheses, but he practiced 25 years as a dentist. I call Herb up and I go, you don't know me from anybody, but I'd love to come and hear about this product. And he tells me where he's at. It's literally 5 minutes from my mom. So I go visit. So let me give you a little background and then we'll get into ioRinse. And I think this is a groundbreaking technology. Okay, so Herb Moskowitz is a dentist and he had practiced for 25 years, but you can immediately tell when you meet Herb, he's a tinkerer. So when I go in and ask him for his bio, he was the chairman and co-founder of obviously now Iotech International. That's the company who makes ioRinse. But he had founded and served as a chairman and CEO of Advanced Tissue Sciences and Life Medical Sciences, which were two publicly traded medical companies. So he's been involved in the medical field outside the dental field for some years. And you immediately know that when you talk to Herb. He talks, he walks the walk, let's just say, of talking the medical route. So I'm gonna bring Herb in, and the first thing I'm gonna ask in these COVID times is why ioRinse as the ideal pre-rinse, let's call it formulation, before a patient really sits down in your chair. Herb, welcome to the show. Talk to me about the uniqueness of ioRinse.
All right, so first, thanks, Lou, and hello to your audience. ioRinse is very unique, and it's, in order to appreciate its uniqueness, you should understand that it's an iodine-based chemistry. It's an iodine-based rinse. But unlike any iodine-based rinse that has been previously available, and in fact, that's why it's patented. The American Dental Association now, for their COVID-19 interim protocols, are advocating either hydrogen peroxide, 1.5%, or 0.2% povidone iodine as a pre-procedural rinse. So when you look on the face of it, of the two choices offered by American Dental Association, the hydrogen peroxide, at the same time that the ADA is recommending it, then on the CDC's website, the CDC mentions that hydrogen peroxide at 1.5%, the same strength recommended by the ADA, requires 18 to 20 minutes to inactivate rhinovirus, an upper respiratory virus. 18 to 20 minutes.
Right.
Okay, so no one is going to be rinsing for 18 to 20 minutes. So it's questionable to me as to the efficacy of hydrogen peroxide for that particular application. On the contrary note, if you look at the povidone iodine has been shown within 15 seconds to inactivate coronavirus. It had not been, at the time, it had not been tested on COVID-19, but on coronavirus, the standard coronavirus used in laboratory testing, which is strain 229E, and it does it in 15 seconds, completely inactivates it. Subsequent to that, there have been citations, published references, which show that that povidone iodine also inactivates SARS-CoV-2, also within 15-30 seconds. So we know that the recommended 50-time dilution, 0.2% povidone iodine, is an effective pre-procedural rinse. Problem is,
So
the problem is,
Herb, before we get to the problem, and we're going to get to the problem, I know what you're talking about, but there are actual studies that you have shared with me that we could share to the audience if they request them, that actually show years ago that a 30-second pre-procedural rinse killed the virus in 30 seconds in comparison to all other pre-procedural rinses. I mean, that was the laboratory's findings when they evaluated the different formulations that we're going to get into. That is correct.
yes, yes.
Is that right?
The other antiseptic rinses were not able to inactivate either the coronavirus or rhinovirus, whereas the ioRinse did. In fact, it did it at 1/4 the strength that ioRinse is now formulated at.
Okay, so now I know the kind of problem you're going to get into. Do people really want to rinse their mouths with povidone iodine? So you've come up with something very, very unique, and I'd love to, let's guide the listeners into understanding they're really not rinsing with that. What are they really rinsing with?
Okay, so there's a lot of stuff in povidone iodine, and only a little bit of that stuff turns out to be the active agent, and that active agent is molecular iodine, I2. So that's present in povidone iodine in trace amounts, only 2 to 3 parts per million, and it's also present in our formulations at 50 times that amount. We have it in some formulations at 50 parts per million, 200 parts per million, 100 parts per million. So much greater concentration of the same active as is present in povidone iodine. But
so let me just let me just stop you there. So when someone has surgery and they're scrubbing their skin or their face and they're going to have surgery, the molecular iodine is basically the active ingredient that is killing what needs to be killed. So you have basically separated out in a solution this molecular iodine and made it far more powerful. That's what's in a povidone iodine scrub to make it even that much more efficacious. Is that correct?
Exactly right. Exactly right.
Okay. Great. So let me ask you this. So you have products with different concentrations. So why the different concentrations?
Okay, so one product that we have, the at-use dilution, is which is our concentrated irrigant, ioRinse concentrated irrigant. It's meant for use with a water pick with a periodontal subgingival tip. Because of the volume of liquid that's being used in the canister of the water pick, which is approximately 300 milliliters, that because of that volume of liquid, so we wanted to, what we call, tone down the amount of molecular iodine present. Still, it's present at 20 to 25 times the strength of povidone iodine, the amount of active in povidone iodine, yet it's non-staining. And so it's more than adequate for any antibacterial, any antiviral, or any antifungal function. But for an oral rinse, a ready-to-use rinse, where there's only going to be at most 30 milliliters, which are going to be circulating in the patient's mouth, so we boosted that to 100 parts per million. And the 50 parts per million is effective, and very effective. It's much more effective than povidone iodine, but the 100 parts per million is what we consider to be the gold standard, if you will.
So let me just concentrate on both these items. I think it's really important. I want to dive a little deeper. So our pre-procedural rinse can be 30 seconds to a minute. Let's just say 30 seconds, we know we get a kill. And we want our patients to gargle in the back so that if that's where some of this virus may be, let them gargle and drool it out. I get that as a pre-procedural rinse. Patients could buy this from the office or online and take it home as a pre-procedural rinse before brushing their teeth. I love the rinse. Let me ask you this, and this is off topic, but the irrigant. So a lot of us have oral irrigation units in our offices, especially our hygienists, and they've been using chlorhexidine or a version of that to irrigate, when they're doing their ultrasonics. Could you use your irrigant in those ultrasonic systems? And I would think a better overall impact than chlorhexidine. Your thought on that, Herb?
Okay, so there are many dental offices that are now using an iodine product, an Iotech product.
Right.
In most cases, they're using the concentrated irrigant, which they dilute,
Right.
which they dilute 1 to 4, because the concentrated irrigant comes at actually 500 parts per million. So when it's diluted 1 to 4, that equates to a 100 part per million solution, and they're using that in the water reservoir bottles of the ultrasonic scalers. They're using it in the water reservoir bottles of their high-speed handpieces, so that the spray and the aerosol that's created is actually iodinated.
Wow. I love that. So they can use it in their water lines, use this for their handpieces. So in a sense, it would be an iodidated aerosol. Then the hygienist can use it in their ultrasonic treatments, and it's iodated treatment. I love all that. Now, specifically, what is that product? Is that IO concentrate? Catch me up here. What is that product?
Okay, so the most economical way that a dentist can use that is with the concentrated irrigant.
Okay.
Because that way they're diluting it and they're getting essentially 4 times as much solution.
Got it. Love that. Okay, so I know you sell both of those, and this is not a commercial. I just want everybody to understand how powerful this system really can be. So let's go back a couple questions, Herb. So for our listeners, so someone says povidone iodine. Okay, now it's molecular iodine. What's the taste like, and does it stain my teeth? Will it stain the patient's teeth? Let's go taste and stain. Go.
Okay, so you cannot taste the iodine in the Iotech products because they're flavored products. They come in either a cinnamon or a mint flavor. So that's a non-issue.
Okay.
Okay.
And what about staining?
Staining, the products don't stain. They just don't stain. They don't stain teeth. They don't stain restorations. They don't stain oral mucosa. They don't stain your hands. And in fact, we also have a product for the hands.
We're going to get to that. But let me just say, I've obviously been using this rinse now, have the concentrate at home, and I absolutely see zero staining in my patients, and we definitely dispense it in the office, have not had a call about staining. And as far as mint or cinnamon, whatever the flavors are, that's been a non-issue. So no stain, taste is fine. Herb, why is this such a good antiviral agent? Can we just talk a little of the chemistry? Why is it good as an antiviral?
Okay, so iodine is a very, very strong oxidizer. It also breaks down the lipid layers and the cell membranes, and it also interferes with protein synthesis and cell metabolism. And actually, that also leads to why iodine is so important as an agent which does not offer bacterial or microbial resistance. So there's no reference in the published literature to show that iodine, not just Iotech's iodine, but any iodine, that it causes bacterial or microbial resistance to develop. That's not true of chlorhexidine gluconate. It's not true of hydrogen
Right.
peroxide. It's not true of just about every antibiotic and most antimicrobials. And that's because of the multiple pathways, the multiple modes of action of iodine in
Okay.
inactivating cells.
Got it. So let me ask you then, another typical question is shellfish allergy. So how do you really determine if someone would be truly iodine allergic? What's the story with that, Herb?
Okay, so there are reports of or concerns about allergy to shellfish or sensitivity to shellfish, as also meaning that one has an iodine allergy. And the same is true, in fact, also of radio contrast media. So, because the iodide is used in a lot of radio contrast media for diagnostic imaging.
Of course.
Okay, so
Right.
with respect to shellfish, it's been shown in the medical literature that it is not iodine that causes the sensitivity. And in fact, if we back up one step and understand that iodine is an essential nutrient, our bodies, all
Right.
of our bodies, even people who think that,
Right.
even people who feel they were allergic to iodine, require iodine as an essential nutrient in order to avoid iodine deficiency diseases. So it's difficult to be as safe as this possibly can be, which iodine is as an essential nutrient. So it's actually a protein in shellfish muscle, tropomyosin, which causes the sensitivity reaction in shellfish. Because iodine is plentiful and found in sea plants like seaweed, also sushi, also in fish, because anything from the sea it generally is rich in iodine, because the sea is rich in iodine. With respect to radio contrast media, even though iodide is a large component of the radio contrast media, it's also been determined that there are ionic excipients within the radio contrast media which have contributed to these sensitivity reactions. And when they swap out these ionic excipients for non-ionic excipients, they find that the severity and also the frequency of these sensitivity reactions fall off dramatically. Couple that with iodide is not present in our molecular iodine products, because even though we boost the level of molecular iodine, we suppress the other species of iodine, including iodide. So it's not an issue, and in fact, because radio contrast media is given IV as a large bolus going directly into your bloodstream for the topical applications for our molecular iodine products, it's a non-issue.
So let me ask you this then. Have you had, in all the sales for the number of years this product's been on the market, have you ever had an issue with allergies? Do you know of?
I know of one instance where someone said where it was not confirmed by a medical doctor, but there was a report, one report of a transient erythema. That's all I'm aware of, and it required no treatment, and that's out of tens of thousands of people using this.
Yeah, that's my point. So I just want to dispel that pretty much right here with everybody, because I'm an ioRinse user, believe in this heavily as a great product. Okay, so this is what we're going to do as we sign off this first one. I am going to then do a part 2 episode on this, because there's a lot of periodontal applications with these products. That will be my second ioRinse, iogel opportunity to dive a little bit deeper with either Herb's son, who's a periodontist in Baltimore, or a few general dentists who have been using this periodontally in their practices. So that'll be part 2. Herb, I want to thank you for sharing everything with our viewers today, and I wish you great success with ioRinse.
Well, I'm also looking forward to you becoming our neighbor down here.
I look forward to it. Dinner at Ben's. I love that. Thank you, buddy.
All right,
See you soon.
take care.
Bye-bye. So let me be clear. We want to hear from you. We want to hear your questions. So what we want you to do is we want you to go to education@midwaydental.com. Shoot us your questions. We'll go right to the experts. I know I'm not the expert, so let's go ask the experts what we should be doing as our next step next week, the week after, and thereafter. I look forward to hearing from you.